A lot of people will agree that healthcare in Canada is in shambles. You can go to an ER, an emergency room, and spend 8 or 12 hours getting to see someone. There are about 40% of people in Alberta who walk away from the emergency room without getting care because the waits are too long. If you go to a family doctor and you have a special problem that needs to go to a specialist, from the time you see your family doctor till you go to an appointment with the specialist till the time you get a treatment, the average wait now is 50 weeks, just short of a year. And on some procedures, it's a year and a half or longer. It's unacceptable. And a lot of people have been blaming immigration lately. The Liberals let in 2.3 million people over their last 2 years in office under Justin Trudeau, and that swamped the system. There's absolutely no question in my mind that that's one of the big problems. But the solution that a lot of people come up with is the wrong one. They say, more money. What we need is to spend more on healthcare. We need to get the federal government to give the provinces more money, and the provinces need to come up with their own additional funds into the system. But a new study just out from the Fraser Institute shows that of the 30 countries that are in the developed world and have universal health care like Canada does, of those 30 countries, we are third highest in spending. Only New Zealand and Switzerland spend more than we do as a percentage of their GDP. We're spending a lot of money. So how come we're 27th in the number of doctors per capita? How come we are 25th in the number of hospital beds per capita? How come we are 27th again in MRIs and CAT scans? And of the 9 countries on that list that publish waiting list statistics, Canada is dead last. We have the longest waiting list of any of the countries that publish waiting list statistics. It's unacceptable. But the reason that we get into this trouble is that Canada is alone among those 30 countries with insisting not only that government pay for health care, but the government also provide health care. Whenever you talk about privatizing delivery, people shriek, they scream. That's going to ruin the system. I'll be kept out of the system. I won't be able to afford it. That's not what the model is at all. What I'm talking about is the government will pay for the service. But in lots of cases, it's much better to have private healthcare providers dole out the service. They're much more efficient. They keep up with the technology. They are far less bureaucratic. In most provinces in Canada, 1 in 6 people in the healthcare system is a bureaucrat. They provide no service. They do not see patients. They don't improve your health in any way. And that makes us about 3 times as bureaucratically heavy as, say, Germany or Sweden. Sweden, I think, is the best example. They took all the healthcare in the Stockholm area about 15 years ago and decided the government wasn't going to provide that anymore. It would pay for it, would pay for all the healthcare, but the private sector would bid on the ability to provide that healthcare. And what they found was costs didn't go down, but they didn't go up either. And service improved markedly. That's the sort of thing we have to start looking at in Canada if we want to get out of our healthcare crisis. For Post Media, I'm Lorne Gunter.